Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and in today's video, we are answering a viewer's question. This mama left a comment on one of my videos, and sometimes I'm able to share my insight or any advice or any resources just by responding directly to the comment. And some questions require a little bit more background, a little bit more depth, and a little bit more tact when responding to parents. So let's check out her question together. Pull up the screen real quick. Okay, so this mama is asking, hi, my girl is 7 months and can't control her neck. Now, when you are a first-time mom or you are kind of just watching your baby develop, head control can be one of the first milestones that babies are mastering as well as pediatricians and parents are tracking. Head control is really difficult from a text-based question to answer, or really to give more information on, because it is very nuanced. Now, when we look at milestones, we are looking at how babies lift and hold their head in a variety of different positions. Traditionally, physical therapists and pediatricians are going to look at, can the baby lift their head off of the ground? And if so, for how long and how high? So I'm going to show you guys a really quick another slide, and we are going to look at what it looks like for a baby to pull their head up off of the ground at 90 degrees. Now, this is a page in my book, Tummy Time and Learning to Roll. So this is a resource that is available internationally. It's available via Kindle in multiple countries: India, Australia, Japan, countries like that. If you are unsure if it's available in your country, just drop a comment and I will double check for you. It's also available in paperback in a bunch of different countries as well. This is gonna be likely the best, most comprehensive resource if a child has concerns about head control and you're looking for different play positions, especially if they're an infant, to work on strengthening that head control. But let's go into it a little bit deeper here. So you can see that the baby in the picture here is lifting their head up against gravity. So gravity is always going to be trying to push the baby's head towards the ground. When babies are newborns, let me show you a picture of what that looks like. They're not able to pull their head up off of the ground. Excuse me. When they're on their belly. So when they first are newborns, 0 to 2 months, they have their heads rotated typically when they're on their bellies, and it's still, again, important to start tummy time right from day one, and for you as the parent or an individual working with a little to actually actively rotate their head for them, because they may or may not be able to do that on their own, and we want them to spend equal time rotated to the left or rotated to the right. Now, as they get a little bit older, you're gonna see, like in this picture, where the baby's able to lift their head slightly off the ground to kind of bring their ear off the ground and just enough to rotate on their own to the other side. Again, these are some more newborn pictures, and this book comes with tons of different pictures. But as a baby gets older, they're gonna then be able to really extend, use the muscles on the back of their neck, extend their heads, and lift their head against gravity. Now, this is both due to increasing strength on the back of their neck muscles, but also by pushing through their elbows. The head is obviously connected to the mid part of our trunk, and so this whole section is really working as a team to push and engage the whole system in which to lift that head up off the ground. So when we're talking about head control, we're going to be talking about it in different positions. Now, the first position you're going to want to look at to determine head control is, can the baby push through their elbows and lift their head up so it's in a straight line, or again in that 90-degree position. If so, then that's great. Then we have mastered head control on our belly. If not, then we need to look at what is limiting that. So is it because they're not pushing through their shoulders? Is it because they are struggling, there's tightness in that region? Or is that head control really just not coming along? The other positions that we want to look at as far as head control go are the front neck muscles. So the front neck muscles are going to look a little bit more like, can the baby tuck their chin as they're being brought up into sitting? So that is going to look a little bit more like this. So I'm going to go again in the book, and I'm going to go to the core strengthening section. So these are a bunch of different exercises, but you can see in this picture here that the baby's chin, and even in the one next to it's a little bit more apparent, the baby is bringing their head and neck down and their chin towards their chest. Now, babies who are struggling with head control often will let their heads leg back as you are bringing them into sitting. If a baby is able to tuck their chin while they're being brought into sitting, specifically with your hands behind their shoulders, that's my favorite because it brings the arm strength and the shoulder strength out of the equation. We're only looking at the neck strength. If they're able to then do that, then that front of the neck strength is there. If their head is really far back like that, then it's not as strong, and we need to look at that. The other two sides of neck strength are going to be the sides of the neck. Now we can look at that by different neck strength screens. Let me see. Here we go. So this is going to be a picture of what a neck strength is going to look like. So we want the babies at a bare minimum to be able to hold their head against gravity as gravity is trying to push their head towards their bottom shoulder. If they're able to fight that, activate the muscle on the top of the neck, then they have what we would call like a 2-month-old against gravity strength basis. That's the baseline. That's the minimum we want a baby to have. If they're not able to hold their head against gravity and their head again is like this, or they cry, or you have to support their head, they're not able to hold it when you hold them in a horizontal position, then their neck is not strong, and you do have some head control or some neck strength considerations in that position. A 7-month-old should be able to either hold their head at horizontal and then also have the strength to bring their head up towards their top shoulder against gravity for 15 to 30 seconds and have that equal on both sides. Now, if that is not the case and they can only hold it horizontally against gravity, they may just need some strengthening opportunities, even just holding that position. I will show you guys a really quick, let me see if I can pop it up. I think it's in my membership. Let's see. Neck strength. Let me see if I can find it. Okay, perfect. Found the video. And so I will show you guys what this looks like, and I'll drop it in the comments below. So how to check neck strength and infants, how to check neck strength in infants, toricollis explained. So we're going to go into neck strength, but then we're also going to talk about how it fits into torticollis, because sometimes torticollis can influence overall neck strength. Torticollis is when a baby has a tilt towards one side and a rotation preference towards the other. Sometimes they just have a tilt, sometimes they just have a rotation preference, but usually they are combined. There is also a risk of flatness on the back of the head in the direction in which that rotation preference is. So let me pop out of here. Okay, so that was a lot. So we're looking at what is neck strength looks like in all 4 directions of the neck. So the neck you can think of as a box. It has 4 sides. We need to make sure that the muscles are strong in all 4 sides to be able to hold ourselves up against gravity. At 7 months, we specifically want to look at, can the baby lift their head up against gravity to a 90-degree position? Can they hold their head at the bare minimum against gravity, but ideally bring their head up towards that top shoulder on both sides equally? And then also when bringing into a sit position, can the baby tuck their chin? And so when we are looking at head control as pediatric physical therapists and also just trying to educate the general population on head control, those are the 4 directions that we really want to focus on. Now, if a baby only struggles with 1 or 2 of those directions, you can utilize the exercises in this book to help strengthen them. I will drop the link to this book in the comments. And it also comes with a free video course. So those are really great resources for you that are available internationally. Now, there is a conversation that I do really want to have for parents. Head control can be a minor concern and it can be a very significant concern. If a baby is 7 months and their head is very floppy and they're not able to hold it up against gravity and you have to support their head and neck while you're holding them, they're not holding it up against gravity when you place them in supported sitting, they're not rolling belly to back or back to belly, they're not picking their head up when they're on their belly. Those are some pretty significant concerns and spots when I am really going to try to advocate for those families to talk to their pediatricians and to get a pediatric physical therapist or a pediatric physiotherapist on board. Typically, if a baby is over the age of 3 or 4 months and they're not bringing their head up to 90 degrees, looking around and rotating in both directions, and they're not able to hold that head up for at bare minimum a couple of minutes, but at 7 months, I'm looking closer to 10 to 15 minutes, then there could be some other concerns. Now, when we're looking at babies, we really want to obviously have a really gentle explanation and conversation with families. And I don't like to have a channel that is fear-mongering or that really scares parents, but I do want to be able to have some tough conversations because the truth is developmental milestones can be insights into things that are happening in a baby's body. They're most of the time are only markers to say like, hey, is this baby at risk for developmental delay down the road? Or, hey, is there maybe something more going on that this baby needs a medical team to try to help determine if something else is underlying here? Now, when we look at babies and we look at ourselves as humans, there's kind of 2 realms of why a baby could struggle. One of the realms is that it's musculoskeletal in nature. That's what a lot of the videos on this channel go into. Babies who are either premature or don't have underlying diagnoses, that the parents just want to make sure that they are getting proactive play positions and so that they can have all they need to be able to develop as their same age peers and master those milestones kind of on time and uncover any movement blocks that might be happening. The musculoskeletal system is like your muscles and your bones and your joints. It deals with strength and tightness and looking at helping babies, but those babies typically do not have anything else going on. Now, there's also the neuromuscular system, and that is how our brain and our spinal cord and all of our nerves connect to our muscles. There are disease processes that can influence how our neuromuscular system occurs. And when we're talking about head control, we really want to be gentle because we don't want to scare parents, but we also really want to be conscientious that there are genetic diseases, there are neuromuscular diseases, there are trauma from birth. There are, babies can have strokes. There's a lot that really can influence how a baby moves. And often, if a baby is 7 months and still struggling with head control, there may be something else going on. And so I really like to be gentle about it, but also to educate parents and say things like, hey, like if we're 7 months and we're having exercises, we're doing tummy time, we're doing all the things, and head control is really still a big concern, and especially a big concern in maybe all 4 directions versus like 1 or 2 directions. Or it's 1 or 2 directions and it's not getting better with 2 to 3 weeks of consistent 20 minutes a day of exercises from this book, or from the channel, then we really want to make sure that babies are getting the medical care that they may need. So make sure that you're talking to your child's pediatrician about any head control concerns. Make sure that if you have any genetic diseases in your families, that your child's pediatrician and healthcare team knows about it. If your child has been diagnosed with something like cerebral palsy or Down syndrome or a genetic condition or low tone, even though that's not really a diagnosis, but can influence things, or had a traumatic birth, you really want to make sure that you have as much intervention as possible for your child as an infant, because when babies are smaller, they are more able to develop neural pathways, they're more able to get stronger because their bodies are littler, versus having low strength or more difficulty. And then as they get bigger, sometimes that strength diminishes even a little bit more, and it can be harder to rebuild back up that strength because of the difference in how the size of the child, just based on gravity and function and things like that. So we do always recommend early intervention, especially as infants. And if head control is a concern at 7 months, it is something that I would recommend looking into and making sure your child is having either a test done or you're talking to your pediatrician, someone in person who actually can put their hands on their child. If you don't have access to that, or you just want to have a little bit more of a conversation with a pediatric physical therapist, I will drop the link to my online parent consultations. They're about 60 minutes of video chatting. We can do them internationally, and they're really meant as a resource to help parents find out what their best next step is and answer some specific questions or general questions on how movement all fits together, how rolling fits together, how sitting fits together, and head control can be a piece of that. So I hope that this video was helpful and that it answers this parent's question about a 7-month-old still struggling with head control in a little bit more depth than I could do just by trying to type an answer to that question. Hopefully this is helpful for any other families who have found this video after filming. And I'm gonna drop this link in response to the parent's question. So hopefully that is helpful for you too, as the person who asked the question. And I hope that you guys have a great day. If you have any other questions on 7-month-olds, 6-month-olds who are not yet developing head control, please drop those in the comments below, and you might get a text response or you might get your own video response depending on the depth of information I feel like is relevant to your question. Obviously can't do video responses to every single question, but I do love trying to educate and making sure you guys feel really supported in your child's movement journey.